We begin this morning with FEMA Director Pete Gaynor, who is now in charge of the government's response effort. Good morning, Mr. Gaynor, and I want to start right away with FEMA's mission, which is to lead America to prepare for, prevent, respond to, and recover from disasters. So how did we get to this point where we have healthcare workers desperate for critical supplies?
It's a great question, Martha. And my role today is about today, it's about tomorrow, and it's about where we are in 2 weeks. My job is to bring together whole of government, whole of nation, to include our business partners to make sure that we can navigate our way out of this. And that's what we're doing every day. So when it comes to things like supplies, we are shipping supplies. We shipped yesterday, we shipped today, we're going to ship tomorrow. We're going to try to meet every need in the nation. But a word of caution, the supplies that governors are looking for are the same supplies that every other country in the world is looking for. So this is a global problem. It's a national problem. And again, we're working hard every day here to meet those demands.
We know you're working hard. The task force announced yesterday that 600 million N95 masks to protect healthcare workers have now been ordered, but no one on that task force, not the president, not the vice president, not you, could answer the question, when will they be ready for use? Let me run you part of that exchange that began with our own Trevor Ault.
When exactly can they expect to receive these masks, though?
Every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain to make sure that
when will
we make
the masks start coming in.
They're out there now.
They're out there now. So can you tell us this morning when those masks will be distributed and how many?
They have been distributed. They've been distributed over the past couple weeks. They're shipping today. They'll ship tomorrow. We find more and more masks to ship because we have developing great partnerships with the commercial sector out there through donations, ramping up production. So again, they have been shipping. We are trying to focus those shipments on the most critical hotspots in the country, places like New York City, Washington State, California. That is our priorities.
But will the healthcare systems there be overwhelmed before masks get there? I know you've been shipping some masks, but these 600 million ordered are very important and critical at this point. Will they get them in time before the health system is overwhelmed?
Again, they're shipping today. They've shipped yesterday. They'll ship tomorrow. And I think one of the things.
When you say they, what do you mean? How many? Which masks? The new masks?
Well, I mean, there's hundreds of thousands of millions of things that we're shipping from the stockpile. I mean, I can't give you the details about what every single state or what every single city's doing, but I'm telling you that we are shipping from our national stockpile. We're shipping from vendors. We're shipping from donations. It is happening. The demand is great. The demand from the governors is great. The demand around the world is great. And I have the best experts here. I have a two-star general from the Joint Staff here, logistics, that is helping me solve these problems, plus many other from government. We are in this 100%.
How many masks were in the strategic stockpile? You said you're shipping from the stockpile. Have all those masks been distributed? And if not, why not?
Again, there are still supplies in the stockpile. We are shipping all those supplies to all the demands, all the asks from all the governors every day. We're prepared to go to zero in the stockpile to meet demand. Again, this is a whole of government effort. And if I could just, and this is shared responsibility. I know the president, Dr. Fauci, talked about testing. If you don't need a test, if you don't have symptoms, please don't get a test, because the demand for PPE on unnecessary testing is something that's working against us. So all in it together. Every American has a role to play, and we ask you, if you need to get a test and you have symptoms, go get it. If you just want a test to make yourself feel better, please don't do that.
I just want one more time on this mask. You say you're shipping them out where they're needed first. You've still got some in the stockpile. I wonder why that stockpile hasn't been depleted. Have you seen the urgent pleas from healthcare workers?
Well, we have. I have talked to governors. I've talked to emergency managers. We've gotten updates through the task force. I am well aware of the high demand for these items.
But again, so why haven't those been shipped to those urgent care facilities? If you have those masks in the stockpile, as you say you have, and they're shipped, why weren't they shipped before? Which really goes back to my original question. How are we in such bad shape at this point in terms of supplies?
Yeah, so again, like I said in the beginning, my focus is today, right? Filling all the demands that have been in the queue, filling the demands that we get today, tomorrow, and through the next month to make sure that we connect the supply with the demand and meet that need.
You said your agency hadn't been invited to join the White House task force until last week. Should FEMA's involvement have ramped up sooner, and why didn't it?
Well, I'm not going to look back on, what should have been done, what wasn't done, and we can do that at a later time. Again, my focus as the lead for coordinating federal operations is on today. We can look back at another date. My eyes are focused today, tomorrow, the next day, in order to beat this coronavirus.
The Washington Post is reporting that the U.S. intelligence agencies were issuing ominous, classified warnings beginning in January about the global danger of coronavirus, all this while President Trump and others were downplaying the threat. The Post says that according to an official, Donald Trump may not have been expecting this, but a lot of other people in the government were. They just couldn't get him to do anything about it. The system was blinking red. The president says this report is inaccurate. So did you know about those warnings? And if not, why not?
When it comes to public health emergencies, HHS has been the lead for that. They kind of own that mission. I was not part of any of those discussions, whether they're purported or factual.
I want to go back to your mission again. It's to lead America to prepare for it. You had no indication. The worldwide threat assessment of 2019 said we assess the United States and the world will remain vulnerable to the next flu pandemic or large-scale outbreak of a contagious disease that could lead to a massive rates of death and disability, severely affect the world economy, and strain international resources. So is it really fair to say you had no warning about this, really?
Again, the public health medical mission statutory lies with HHS. My mission, FEMA, prior to this, natural disasters and those catastrophic events that happen. Now it's a different world. Now HHS and FEMA are locked arm in arm, plus many other agencies from around government to include our private partners. And today, I'm trying to focus on today and tomorrow and where we want to be in a couple weeks. That is my mission.
And what do you think we'll see in a couple of weeks? A big change?
Well, again, I think every American has a role to play. I think the 15 days, do what you can do to help yourself, help your family, help your neighborhood, help your business. Do those things that are simple. Stay indoors. If you're sick, don't go to work. Wash your hands. Don't touch surfaces. All those things make a difference. This is every American playing their role to make sure that we can beat the coronavirus. That's as simple as I can make it.
Thanks very much for joining us this morning, Mr. Gaynor. Appreciate it.
You're welcome.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.